Hello, my name is Allison Hartley, and I'm a student nurse with Nightingale College, and today I am going to be performing a dressing change on my patient. So I gathered all of my supplies. I'm going to perform hand hygiene, walk in my room, introduce myself to my patient. Hi, my name is Allie. I'm going to be your nurse today. What is your name and date of birth? They would tell me, and I'm going to check their wristband, and it matches perfectly. Okay, so today I'm going to perform a dressing change on you to keep it clean. It'll just take about a couple of minutes, if that's okay. Perfect. And then I will draw the curtain to provide privacy, and then I'll begin. So, hand hygiene, and I'm going to put on some clean gloves. Perfect. And I am going to go over to my patient and their wound. I'm going to take off their dressing parallel to their body, and I'm going to get rid of that. Perfect. I'm going to inspect my patient and their wound for anything out of the ordinary, any discoloration, any drainage, any signs of infection, just making sure that it looks like a healthy wound site. It looks fine, so I'm going to discard of my gloves into the trash bin, perform hand hygiene, then I'm going to get ready for my dressing change. Here I have my central line dressing change kit. I'm going to open this. I'm going to wrap that underneath just to keep it out of the way. Here I am going to get out my sterile gloves. And I am going to put these on sterilely. So I'm grabbing the 1-inch borders on each side. And I'm going to grab this glove by the cuff with my non-dominant hand. I believe it said that's the left hand actually. Okay. What am I do? I'm going to put it on, just grabbing by that cuff. And now it's on. Then with this other one, I'm going to make sure this is open again. I'm going to, with my sterile glove, grab underneath the cuff here and be able to put this one on sterilely. Keep my hands clean for my patient. Okay, so now I'm going to have one non-sterile hand, and that is the one going to be grabbing all of my supplies. One sterile hand, and that's the one working on my patient. Okay, so I'm going to get rid of that. Bring my sterile dressing closer. I am going to grab my wound cleanser, and with my non-sterile hand, drop it into my sterile hand. I am going to go in a circular motion on the wound, going from the inside out. Okay, and discard of that. Perfect. Still keeping sterility, I'm going to take my non-sterile hand, grab the gauze, drop it into my sterile hand so I can dry, going from the inside out. Get rid of that. Then I can use both hands for the actual dressing. I am going to take my dressing, open it up, and I can place it right over the wound. And take off the outer wrapper, making sure it is sticking all the way around on my patient, so that way nothing can go in there. I'm going to initial and date it, so that way other nurses understand when I did it and who did it. I'm going to ask my patient, okay, are you comfortable? Do you have any questions for me? Here is your call light if you need anything. And then I'm going to discard of my gloves, perform hand hygiene, and document what I did with my patient. Thank you.